Hi, this is Adam Wolf. Wanted to talk about using the Edge Mobility Suspension Strap Trainers in our Rule the Tool series. As I mentioned before, I like to use the trainers to create thoracic spine motion particularly. I will work on people using the straps here, particularly to create thoracic spine motion. The idea being we got to understand real and relative motion a little bit, and that bones move, joints feel, and muscles react. So we got to get bones moving faster or slower than other bones to create this synchrony of dissociation necessary for joints to feel motion. Okay. So Abby, what I'm going to have you do, I'm going to use Abby here. She's going to go into this position. I'm going to have her. We're going to start with just a straight fall out. So you're going to start in this position right here. And I'm going to have you just fall out into this position. What I'm going to do is put my hands on her chest to create some thoracic extension here. Okay, so when she gets into this position, one hand, and this is exactly what I'll say to patients, I'm not getting fresh with you. This hand's going to go right to the top of her chest right here. This hand is going to go to the bottom of her chest. So let's just turn to face this way really quickly, Abby, and you can see where my hands are. This hand's lower, kind of thoracic, upper lumbar. My front hand is right on her chest right here. As she goes through some motion here, go ahead and just drop out. I'm just pushing the bottom hand forward and kind of pushing my top hand backwards, and I'm doing some of this stuff here. So as she goes through, yeah, I got a little adjustment in your spine as we did that there. I can create some nice thoracic motion. Okay, so from here, let's go ahead and do that step where you're going to add a little bit of a step. Move forward first to start. Yep, bring your hands down. Yeah, right there. So now I go ahead and do that same step. You got it, in and out. And I'm going to start to add a little bit more dynamic movement here. I'm just going with her here, and at the right time, I'm just facilitating a little bit of pure plane extension coming through here. Okay, so that might be the next strategy that I use. Working on creating that type 2 motion now, what I'm going to do is I'm going to take one strap and make it slightly smaller than the other strap. Her left hand now is going to come up overhead. She's side bent to the right. Her right hand being in along her body or out behind her rotates her right. We're going to be able to set up a nice extension moments through these type 2 motions. You're going to do that same alternating lunge here. Yep, in and out. So once she gets going, then I can start to add a little rotation here. So I can start to just, with this hand right here, just start to rotate. So what I'm doing is she's going now, I'm rotating my top hand to the right faster than my bottom hand. It's creating that right rotation in her spine. Okay, so that might be one strategy. I can take both hands, rather than speeding up the top, I can slow the bottom and think about almost steering her the opposite direction. So both hands now are twisting her to the left, below, which also gives her right rotation above. I can be very specific or very general on where my hand placement is here for this. I can get into these type of positions here across her body, also working to create some thoracic extension. So here's some ways working in the thoracic spine using my hands to sort of create and facilitate some motion. Let's say that I wanted to work on her right hip extension using, so what I'm going to have you do is that same fallout. Let's even these out here. Okay, so you're going to do that first one where you're going to lunge. Let's do that but with the step. So we'll do the lunge. You got it. Good. Move a little farther forward. Yep, just a left foot forward lunge. Go ahead, just left. Good, in and out. Keep doing that, left foot forward. Let's say I want to work on her right hip extension here. Let's say that as we're doing this, we deem that her femur and pelvis are moving at the same speed as we do this, and I want to get her pelvis moving faster forward than her femur. Well, then maybe I can block my distal hand on her femur here, or my hand on her distal femur, to just slow it down. I'm not pulling her femur back towards me. I want it to go forward. It should. I'm just making it go a little slower than what's above. And then I can take my top hand and I can sort of facilitate a little bit of motion. And then all of a sudden she feels a little bit more hip flexor stretch or anterior hip stretch. So just using this tool to create some strategies. Hopefully this gives you a couple things to work with. Certainly spurs some discussion. Thanks.